Dr. William Davis here, author of the Wheat Belly and Undoctored books. I was watching TV recently, the news, and a commercial came on with Bob Harper. You may recall he's the athletic guy who was on the Biggest Loser TV show. Well, you may know that he had a heart attack and had to have a stent implanted. Now he's on these commercials for the antiplatelet agent that he has to take because he has steel. He has a steel stent in his coronary arteries. Well, why do athletes have heart attacks? I'll tell you that the profile of risk in athletes tends to be somewhat different than everyday people. They're in good shape, right? They're slender, they have good insulin sensitivity. They don't have a lot of the problems that lead to heart disease that many other people have who are not as athletic. So people who are not so athletic have a whole constellation, a whole landscape of abnormalities that are driven by insulin resistance. Low HDL cholesterol, high triglycerides, high VLDL, small LDL particles, higher blood sugar, higher hemoglobin A1C, higher inflammatory measures, right? Those are the non-athletes. The athletes tend not to have, they can have that, they don't tend to have it as bad as other people. But why are they having heart attacks? Why does Bob Harper have a stent? Why do these marathon runners often, you've heard these stories, they cross the finish line and collapse and die, or they have a heart attack afterwards? Well, there may be a collection of reasons, but I want to highlight two reasons. One is many of these athletes have a very specific genetic pattern called lipoprotein A, okay? So the lipoprotein A person tends to follow a very specific type. We say a phenotype. They tend to be very slender. They tend to be very athletic. They're often very smart and especially good at numbers. So a lot of people with this genetic pattern, lipoprotein A, tend to be financial analysts, accountants, electrical engineers, mathematicians, people who are good at numbers. They also have a hard time often gaining weight. They tend to be very slender. And they are very good at tolerating periods of dehydration and not eating for extended periods. So I call these people perfect carnivores because when you think about this collection, they love long distance exercise, they're very fit, they're very slender, they are tolerant of periods of deprivation of water and food. This is a survival advantage. So I see lipoprotein as a tremendous survival advantage. But how does it also show that other face of increased coronary risk? And it can be very risky. You can have heart attacks in your late 30s, 40s, 50s, particularly if that's in your family. Well, lipoprotein A people, we're all susceptible to the effects of grains and sugars, right? So if everyday people eat grains and sugars, you gain fat, visceral fat, you become inflamed, your triglycerides go way up, small LDL appears, high blood sugars, diabetes, etc. Well, lipoprotein A people likewise can develop those problems despite remaining slender, but they develop some responses out of proportion to other people, much worse than other people. For instance, the small LDL particles. These people, they tend to be slender, right? They tend to be bone thin often, and long distance runners or joggers or bikers, yet they have oodles of small LDL particles. They develop small LDL particles more so than other people. And the small LDL particle is one of the components of the lipoprotein molecule. The lipoprotein molecule is two things: apoprotein A programmed by genetics and an LDL particle. When the LDL particle is small, the lipoprotein A combined molecule is much more dangerous. We say atherogenic, causes atherosclerotic plaque and heart attack. So one of the things that a guy like Bob Harper and athletes need to think about, particularly if you're slender, fit, and tolerate periods of food and water deprivation, is get your lipoprotein A checked. Now, you don't treat it with a statin drug. That's stupid. I tell you what we do in our Undoctored Inner Circle program. We use a high-fat diet, and it works magnificently. We use high-dose fish oil. We weigh our diets heavily in fat, and we eat absolutely no grains or sugars that would have provoked formation of small LDL particles. So that's one big reason. The genetic pattern called lipoprotein A, unique to slender, fit people. Two, a lot of these athletes carb load, right? They still do that silly thing, thinking it'll increase their performance. Well, carb loading causes small LDL particles, once again, to explode, as well as other abnormalities. VLDL, high triglycerides, fatty liver, high blood sugar, high hemoglobin A1C. So carb loading is a terrible, terrible thing to do. Now, if you follow the Undoctored or the Wheat Belly Total Health programs, you'll go through an obligatory 6-week period where your exercise performance drops before it rebounds. And that's because your body has to accommodate to fat burning and away from carbohydrate burning. But recognize that carb loading for an athlete is a horrible practice, and one of its consequences is heart attack and heart disease. So there you go. You can be fit, but you gotta be smarter. And look for coronary risk factors like lipoprotein and small LDL, and then correct the causes.